Hearing loss affects both the hearing impaired individual and their family and friends. Whether your loved one with hearing loss wears hearing aids or not, there are several communication strategies that will help both of you. We will highlight 10 helpful strategies today. The first 3 strategies involve optimizing your environment. First, minimize the distance between yourself and your family members. Don't attempt to communicate from different rooms because sound loses energy as it travels. Make the effort to walk into the same room before you start speaking. Second, you want to minimize background noise when possible. For example, turn down the volume of the television or radio even when you're in the same room, and when you're not at home, you can sometimes control the amount of background noise when choosing where you sit in a restaurant. For example, don't choose the table by the noisy kitchen or the table in the middle of the restaurant where you're surrounded by background noise 360 degrees. You can also make note of where the speakers are in the room if they're playing music. Third, keep in mind that the type of room will affect the acoustics. So large room with hard surfaces and tall ceilings will create more reverberant noise and echo, whereas smaller rooms with carpeting and drapes will absorb some of this extraneous echo and distortion. You also want to keep adequate lighting in the room to help your listeners see your face while you talk. The next several strategies relate to things that you can do as the speaker to maximize your listeners' chance of hearing and understanding you. First, keep in mind that attention plays an important role in hearing and listening. Say your loved one's name first and wait until they turn and look at you before you begin speaking. This allows them to stop what they're doing or thinking and get ready for the next new task, which is listening to you. Number 5, always stay face to face with your family member when you're speaking. Don't walk away as you're talking. This allows your loved one to get extra information from reading your lips and watching your facial expression, in addition to keeping the physical distance between the two of you at minimum. 6th, monitor your rate of speech. Especially if your loved one already has hearing aids, the volume at which you are speaking is often not the problem. However, clarity can be the problem. Slowing down the rate at which you speak will naturally force you to articulate what you're saying and be more clear. Number 7, if the conversation is breaking down, you can use what are called repair strategies to keep moving forward. If your loved one is stuck on a certain word or idea, you can rephrase it, spell it, or try having them repeat back what they did hear to narrow down where the breakdown occurred. Number 8, as the conversation changes topics, it's helpful to provide a topic check to your family member with hearing loss. This allows your family member to use the context of the conversation to help fill in the gaps of the specific words that they might miss. 9th, encourage your loved one to be assertive in their listening needs and what helps them. Some things are in their control, such as arriving early to get a good seat and asking people to slow down if they're talking too fast. Finally, be patient with your family member, as the situation can be stressful for them as well. Be open to experimenting with a combination of different strategies depending on what seems to work best. Thanks for listening, and I hope that these tips are helpful for you the next time you're speaking with someone with hearing loss.